And it is for the people that we stand here today to assist families, uplift workers whose basic livelihoods have been threatened, strengthen our community hospitals, and support our frontline healthcare workers. We are here to deliver relief to people, like the owner of a community bookstore in Andover, Massachusetts, whose business has been crushed, to keep our end of the bargain for the hospital workers at places like Lawrence General and Lowell Community Health Center, and so many others who are putting their lives on the line each day.
We all have seen 2020 go from some great expectations to, some of the scariest moments in our lives. And having to sit down with members of the healthcare community in my office to talk about a global pandemic. We have 149 people have died from this vicious virus. Early on for us, it was always concerned that this was going to be crazy.
The testing challenge immediately was present, even within our incident command structure, when we ended up closing all elective surgeries and ended up having to manage our visitors and manage the amount of patients that were coming into the hospital for COVID.
In Lawrence and the greater Lawrence area, there's really specific places you can go and get healthcare. And so right off the bat, we knew important when we were going to make the first message of how bad this thing was and what we needed people to do. We were going to do it at the hospital. So our first COVID-19 press conference was at the hospital. We were telling people just to stay home. It was an incredibly important part of this early on to have the hospital at the table.
We really needed a plan for testing that went further than what we were currently doing in the emergency room and across the street from Prospect Street. And the mayor had come to us and said, I think that there's some opportunity here for you to make something bigger and be able to provide more services to the city of Lawrence.
We said we were going to spend city money to test people, and we dedicated $1 million to it. And we would never have done it with anyone else other than the Lawrence General Hospital. People understand that that's where you go to get quality health care, and for them to lead this, the testing for us was crucial.
Having this testing today goes such a long way, and it truly matters, because so many of those people that you're seeing on the front line in our grocery stores delivering our goods are here right in the city of Lawrence, and that's why we need this testing here today.
The only way that we are going to stop this virus is if we can continue to test people, find out who has this as soon as possible, and help them protect their families.
Lawrence General's role was really truly to operate that center and grow it from the small 2-lane site to the larger 8-lane site that's currently in operation. And then additionally add the mobile health unit that now services the city in really needed areas throughout that city.
This mobile testing unit is already out on the road. The mayor says they made it loud and bright so people would see it. It'll be replaced by this $250,000 version, which is a little bit bigger next year.
There are many patients who are not able to come to our hospital site to be COVID swabbed. So what we've done is we've created opportunity for those patients to be seen here, where they live, in their environment, where they shop. And we're taking care of all ages here, and we're also doing flu shots for these patients, which has been great, making sure that we provide access to care close to home, and that's what we're really focused on.
Managing a public health crisis is not something that we are not used to in Lawrence, at Lawrence General Hospital, and we are really nimble and we are able to respond very quickly to emergency situations. But it quickly became very apparent to us that we were not going to be able to financially sustain how the reimbursement looked like for testing in the beginning of COVID.
The state gave us about 15,000 tests early on. We were trying to figure out how to pay for the tests, and all of a sudden all the tests became payable. Like, we figured out the math around the tests. And then we figured out the math around the lanes, and we figured out how do we get people who are undocumented. All that stuff got figured out quickly, and then as soon as we had a new mission, which was how do you get the mobile units up, and how do you do the flu shots? Like, all that stuff was pivot, and they've hit the mark every time.
In addition to adding the flu vaccine to our service line here, we also look in the future to meet the need of the community by providing the COVID vaccine. So we're already in planning modes and purchasing fridges and freezers and looking to staff up to be able to do that.
It has worked out just as we expected, but I don't think that people expected us to do that. We had the expectation that Lawrence General Hospital could do this with the city. But I think people who live here can't believe the quality they're getting from those testing sites.
I think the key moment to really move testing forward was the pure collaboration of all of our partners that worked with Lawrence General to truly make this happen. And this testing site is really the testament of that. It really shows that we are really ready to handle anything that this pandemic has thrown at us, and that we are here to ensure that people are kept safe and healthy and that they are educated from a public health standpoint.